Sedation Dentistry. You're big on sedation dentistry.
Yeah, absolutely. I'm big on it because my patients are big on it. They love it.
Okay.
Once I started integrating into the practice, I made sure to integrate all forms of sedation that are really possible in dentistry. On one end, we have nitrous oxide sedation. That's the laughing gas that most people know about.
Yeah.
People love it, especially for cleanings, little fillings, things like that.
It is relaxing.
Yeah, it takes the edge off, keeps you relaxed, makes the experience much more comfortable. But sometimes that's not enough. Sometimes we're going to do some more complex procedures. You're going to be in the chair a little bit longer. You'd rather not really remember what's going on or totally know what's going on, be on the verge of sleep. That's where oral sedation or the pills come in.
Okay.
They're quick, easy, very predictable, very safe. A lot of people are worried about that. They're amongst the safest medications you can prescribe. And they will just make time fly by. Make the process so much easier that usually when people start with oral sedation, they're never going back. They'll never do dentistry. They'll never do dentistry any other way because it relaxes them so much. And then the final, I guess, tier is IV sedation. And for that, I bring in a medical anesthesiologist, an MD.
You use them a lot on your big implant cases.
Absolutely. I use them. I use them for anybody who wants it.
Okay.
I don't discriminate. If you think you need it, then you need it. And I'll bring in the anesthesiologist. We'll put an IV in your arm. You will essentially go to sleep.
Is it safe?
It's extremely safe. I've got an MD anesthesiologist there.
Okay,
they interview you before the procedure, go over your whole medical history, make sure that you are absolutely a candidate for this and there are no safety measures or precautions that we need to take. So that when we are ready to go, the anesthesiologist is there. They know you better than your MD knows you.
Okay.
I'm focused on the dentistry and we are just getting through this as comfortably as possible.
Now, when I have dentists on this program and they say, Randy, numbing them up is enough. Do you think that's insensitive?
I don't like to use the word insensitive, but...
Or they don't get it?
They don't get it. It's an easy trap to fall in where you tend to take for granted that people are kind of getting through the procedure and we are not really taking into account the anxiety that's going on in their minds.
All right.
I have a rule in my practice. You don't white knuckle it in the chair. If I see you uncomfortable, if I see you grabbing the armrest, I tell you, listen, there's a different way to do this.
Good.
We sedate you. You're going to feel so much better and you're going to thank me later. They all do. Every patient. I've never had a patient tell me, I don't need that stuff. They're like, thank God you introduced this. This made the process so much easier.